Right now, something may already be happening inside your body, not somewhere you can see or feel, inside your veins, inside the vessels carrying blood to your heart and brain. Most seniors with high blood pressure are doing everything right, taking medication, watching their salt, checking their numbers, but here is what almost nobody is telling you. High blood pressure doesn't just strain your heart, it silently damages your blood vessels, causing them to narrow and forcing dangerous blood clots to form inside your arteries. Without pain, without warning, without a single symptom you would notice until it is too late. In this video, we are covering the 5 silent signs that your high blood pressure may already be forming dangerous blood clots right now. Signs most seniors dismiss as normal aging and most doctors miss entirely at routine checkups. Stay through all 5, because sign number 4 is hiding inside a symptom millions of seniors experience every single day, never once connecting it to their blood pressure or their clotting risk. What comes next could genuinely matter. Welcome to Thrive at Any Age, the channel dedicated to giving adults over 60 the honest, research-backed health guidance that most doctors simply don't have time to explain. Everything you are about to hear is grounded in published, peer-reviewed science from leading cardiologists and vascular specialists across the US and UK. We dig into the research so you don't have to, and we present it in plain English you can actually use. Quick note before we continue, this video is for educational purposes only. Please speak with your doctor before making any changes to your medications or health routine, but bring what you learn here into that conversation. You deserve care built on current evidence. Now let's talk about what high blood pressure is really doing inside your body after 60. Most people think of high blood pressure as a number, a reading on a machine, something your doctor monitors and manages with medication. And if the number looks acceptable, you assume everything is fine. But that thinking is exactly what makes this condition so dangerous after 60. Here is what is actually happening inside your body. Your arteries are not rigid pipes. They are living tissue, flexible, responsive, and lined with a delicate inner layer called the endothelium. That lining is your body's first defense against clot formation. When it is healthy, blood flows smoothly and clots dissolve naturally before they cause problems. But when blood pressure stays consistently elevated, even at levels most doctors consider borderline, that inner lining takes damage. Think of it like water pressure inside a garden hose. A little extra pressure is manageable, but sustained high pressure over months and years causes the hose to crack, weaken, and eventually fail. Blood vessels damaged by high blood pressure narrow, break, or leak, and blood clots begin forming in the arteries leading to the brain. And after 60, this process accelerates. Your arterial walls naturally become stiffer with age. Your blood thickens slightly. Your body's natural clot-dissolving mechanisms slow down, which means clots that a younger body might dissolve on its own can persist, grow, and travel in an older one. A major study analyzing over 5.5 million UK adults found a direct association between elevated systolic blood pressure and significantly increased risk of venous thromboembolism, dangerous blood clots forming in the veins. The risk was not limited to people with severe hypertension. Even moderately elevated pressure was independently linked to clot formation. Consider Gerald. He was 64, a retired firefighter from Chicago, fit by most measures, active, on a single blood pressure medication that had kept his numbers reasonable for 3 years. He came to his doctor complaining of occasional heaviness in his left leg and mild shortness of breath when climbing stairs. His doctor attributed both to age and his previous years of physical strain. 8 weeks later, Gerald was hospitalized with a deep vein thrombosis, a dangerous blood clot in his leg that had been silently forming for months. His blood pressure had been borderline elevated for over a year. Nobody had connected the two. That connection is exactly what we are covering today. Before we get into the 5 signs, I want to hear from you directly. Go to the comments right now and type pressure if you are currently managing high blood pressure and have never been told it could be connected to your clotting risk. Type clots if you or someone close to you has experienced a blood clot, deep vein thrombosis, or unexplained swelling in the legs. And if both apply to you, type both. We read every single comment on this channel, and your responses help us understand exactly how many seniors are living with this connection completely unknown to them, which is exactly why this channel exists. Comment now, then stay with us, because sign number 4 is the one that will genuinely surprise you. Sign number 1, persistent heaviness or swelling in one leg. This is the sign most seniors chalk up to standing too long, sitting too much, or simply getting older. A dull heaviness in the calf or thigh, mild swelling around the ankle that appears toward the end of the day, shoes that feel tighter than they used to. It feels like nothing, but it may be everything. When high blood pressure damages arterial linings over time, blood flow becomes restricted. Fats accumulate on the unsmooth, damaged surfaces, narrowing the vessels further and eventually limiting or preventing blood from flowing freely. That restricted flow creates the perfect conditions for clot formation. In the legs specifically, this manifests as deep vein thrombosis, a clot forming silently in the deep veins of the lower limb. The dangerous part is the timing. By the time swelling becomes visible, a clot may have been building for weeks or months. And if a clot breaks off and travels through the bloodstream, it can become lodged in the lungs or heart, a medical emergency that arrives without warning. Remember Gerald, the retired firefighter we mentioned. 8 weeks of dismissing that leg heaviness, connected to age, not blood pressure. By the time anyone made the connection, he was in hospital. The practical step: if you notice persistent swelling or heaviness in one leg, particularly if it is one-sided, do not wait. Tell your doctor specifically and ask for a Doppler ultrasound to check for deep vein thrombosis. One leg swelling is always more concerning than both legs swelling equally. And if sign number 1 surprised you, sign number 2 is something almost every senior experiences and almost nobody connects to blood clots. Sign number 2, unexplained shortness of breath during light activity. Climbing a flight of stairs, walking from the car to the front door, getting up from the sofa. If those activities leave you more breathless than they used to, and your doctor has told you your lungs are fine, the answer may be in your circulation, not your breathing. High blood pressure causes blood clots to form in the arteries leading to the brain, but clots also form in the pulmonary arteries leading to the lungs. A pulmonary embolism, a clot that has traveled to the lungs, reduces the lungs' ability to oxygenate the blood efficiently. The result is breathlessness during activities that never caused a problem before. Not dramatic gasping, just a quiet, persistent reduction in your capacity that creeps up so gradually you barely notice it happening. Research published in a 2025 American Heart Association review identified dangerous blood clots as one of the most underdiagnosed contributors to unexplained breathlessness in adults over 60, particularly those with a history of hypertension. Patricia was 66, a retired accountant from Edinburgh. She had mentioned breathlessness at 3 consecutive annual checkups. Each time she was told her lungs were clear and her heart rhythm was normal. It was only when a new doctor ordered a CT pulmonary angiogram specifically looking for clots that a small but significant pulmonary embolism was found. Her blood pressure had been stage 1 hypertensive for over 2 years. The practical step: if you experience unexplained shortness of breath during light activity, and especially if you also have high blood pressure, ask your doctor specifically about pulmonary embolism screening. Do not accept "your lungs are clear" as a complete answer. Clots and lung capacity are 2 separate questions. Sign number 3, sudden or recurring headaches at the back of the head. Most headaches are benign: tension, dehydration, poor sleep. But there is a specific type of headache pattern that doctors now recognize as a potential warning sign of elevated intracranial pressure caused by hypertension-related clotting, and it is consistently overlooked. The headache is typically located at the back of the head or the base of the skull. It tends to appear in the morning, often upon waking. It may throb or pulse, and it frequently occurs alongside a blood pressure reading that is higher than usual. Blood clots caused by high blood pressure can block blood flow to parts of the brain, causing transient ischemic attacks, which are often preceded by recurring headaches that seniors dismiss as ordinary tension or sinus pain. A transient ischemic attack, sometimes called a mini-stroke, is a full medical warning that a larger stroke may follow, and the window to intervene is narrow. The 2025 ACC AHA Guidelines on Hypertension Management specifically highlighted recurring morning headaches in seniors as an underreported symptom warranting urgent blood pressure evaluation and clotting risk assessment. The practical step: keep a simple headache log for 2 weeks. Note the time, location, and your blood pressure reading at the time if possible. If a pattern emerges, particularly morning headaches at the back of the head, bring that log to your doctor. Patterns matter far more than individual episodes. Sign number 4: sudden confusion, memory gaps, or moments of mental blankness. This is the sign that surprises people the most, and it is hiding inside something millions of seniors experience and attribute entirely to age. A moment where you lose your train of thought mid-sentence, a brief episode where a familiar word won't come, a few seconds of confusion that passes so quickly you almost wonder if it happened. These are often dismissed as senior moments, normal agging, nothing to worry about. But leading neurologists and cardiologists now recognize these brief cognitive interruptions as potential signs of transient ischemic events. Microinterruptions in blood flow to specific areas of the brain caused by small clots temporarily blocking arterial pathways. Research published in 2024 from Yale University's Department of Neurology established a direct and measurable link between blood pressure fluctuations and cognitive function in older adults, finding that even brief periods of elevated pressure were associated with measurable reductions in cognitive processing speed and short-term memory. The mechanism is straightforward. High blood pressure causes blood clots to form in the arteries leading to the brain, and narrowed or blocked arteries limit blood flow to the brain, contributing to a type of dementia called vascular dementia. Those brief mental blank moments are your brain telling you something is interrupting its blood supply, not permanently, not yet, but repeatedly, and with accumulating damage each time. The practical step: do not dismiss sudden confusion or brief mental blanks as normal agging, especially if you have high blood pressure. Mention them specifically to your doctor and ask about cognitive screening and cerebrovascular assessment. These moments deserve a conversation, not reassurance. Sign number 5: unusual fatigue that sleep does not fix. We have reached the final sign, and this is the one that is most universally dismissed because tiredness after 60 feels inevitable, expected, just part of the territory. But there is a specific fatigue pattern that is different from ordinary tiredness. It is a fatigue that arrives regardless of how much you slept, that is present first thing in the morning, that is not explained by activity level or emotional state, that feels more like heaviness than sleepiness. This pattern of fatigue, persistent, unrefreshing, and present even after adequate rest, is now recognized by cardiologists as one of the earliest systemic signs of reduced cardiac output caused by hypertension-related vascular damage and clot burden. High blood pressure damages arteries and increases the likelihood of blood clot formation, and as clots accumulate and restrict blood flow, the heart must work significantly harder to circulate blood through increasingly resistant vessels. That sustained extra effort depletes energy at a systemic level. The result is a fatigue that no amount of sleep resolves, because the problem is not rest, it is circulation. A 2024 review published in the European Journal of Preventive Cardiology found that unexplained persistent fatigue in adults over 65 with hypertension was significantly associated with elevated clotting markers, and that those patients had measurably higher rates of cardiovascular events in the following 18 months compared to hypertensive patients without fatigue symptoms. Margaret, a 71-year-old retired nurse from Bristol, had mentioned persistent fatigue at every checkup for nearly 2 years. She was sleeping 8 hours a night and waking exhausted. Her iron levels were normal. Her thyroid was fine. When her new cardiologist ordered a comprehensive clotting panel alongside her standard blood work, her D-dimer levels were significantly elevated. She had been living with a chronic, low-grade clotting burden for months. The practical step: if you are experiencing persistent fatigue that sleep does not resolve, and you have high blood pressure, ask your doctor specifically for a D-dimer blood test and a clotting factor panel. These are simple, inexpensive blood tests that are not routinely ordered but can reveal clotting activity before it becomes a crisis. If you have made it this far, you are someone who takes their health seriously. And that means you almost certainly know someone who needs to hear this too, a spouse managing blood pressure for years who has never been told about the clot connection. Share this video with one person today. Drop a comment below and tell us which of the 5 signs surprised you most. Was it the legs swelling, the mental blanks, the fatigue that sleep doesn't fix? Now let's take a breath, because everything we have covered in this video could feel alarming. 5 signs. 5 ways your high blood pressure may already be working against you in ways you never suspected. And it would be completely understandable to feel worried right now. But here is what I need you to hold on to. Every single sign we covered today is detectable. Every single risk we discussed is manageable, not with dramatic lifestyle overhauls, not with expensive treatments, with awareness, with the right conversations, with asking your doctor the right questions at the right time. High blood pressure after 60 is not a life sentence. It is a condition that responds measurably and consistently to informed management. The seniors who fare best are not necessarily the ones with the lowest numbers. They are the ones who understand what their numbers mean, who know what questions to ask, who do not accept everything looks fine when something does not feel fine. Think back to Gerald, the retired firefighter who dismissed the heaviness in his leg for 8 weeks. He did not lack intelligence or awareness. He lacked information. Nobody had ever told him that his borderline blood pressure and his leg symptoms belonged in the same conversation. You now have that information, and that changes everything. Step 1. Write down your last 3 blood pressure readings. If you do not have them, check your notes from recent doctor visits or invest in a basic home blood pressure monitor. You need your pattern, not just your last number. If any readings were consistently at or above 130/80, bring that pattern to your next appointment. Step 2. Check both legs tonight. Sit down and press gently on your lower calf and ankle on both sides. Note any difference in firmness, warmth, or swelling between the 2 legs. One-sided swelling is always more significant than equal swelling on both sides. If you notice a meaningful difference, contact your doctor this week. Step 3. Start a symptom log today. Track 4 things daily: your energy level on waking, any headache location and timing, any breathlessness during light activity, and any moments of mental confusion or blankness. Do this for 2 weeks and bring it to your doctor. Patterns tell a story that a single appointment never could. Step 4. Ask for these specific tests. At your next appointment, ask specifically for a D-dimer blood test to check for elevated clotting activity, a Doppler ultrasound if you have any leg swelling or heaviness, and a cognitive screening assessment if you have noticed memory gaps or mental blanks. These are not exotic or expensive requests. They are standard tests that are simply not routinely ordered unless you ask. You have every right to ask. Step 5. Review your blood pressure medication timing. The 2025 ACC/AHA guidelines on hypertension management now recommend that medication timing be individually optimized, meaning the time of day you take your medication may significantly affect how well it controls your overnight and morning pressure spikes. Ask your doctor whether your current timing is optimized for your overnight blood pressure pattern. One final note: please do not stop any medication or make any changes to your treatment plan based on what you have learned today. What this video gives you is not a reason to act alone. It is a reason to have a better informed conversation with your doctor. Bring these questions, bring your symptom log, bring your blood pressure pattern. You are not being difficult. You are being exactly the kind of informed patient that leads to better outcomes. Because that is exactly what thriving at any age looks like. If this video opened your eyes to something you did not know before, subscribe to Thrive at Any Age right now and turn on notifications so you never miss a new video. Every week, we publish new research-backed content designed specifically for adults over 60, presented in plain English, focused on the things that actually affect your daily quality of life. Tell us in the comments which of the 5 signs surprised you most, and where are you watching from? We have viewers across the United States, the United Kingdom, Canada, and Australia, and every comment reminds us exactly why this channel exists. And share this video with someone you love who is managing high blood pressure. Not next week. Today, one share could be the reason someone catches something early enough to change the outcome. We started this video by saying that something may already be happening inside your body, silently, without pain, without warning. And that is still true, but you are no longer watching without knowing what to look for. That awareness is everything. Take care of your pressure, because your life depends on it.